Hi, friends. It's me again. I just wanted to take a moment to come on here and talk about blood cancer, since September is Blood Cancer Awareness Month. In a previous video, I discussed my diagnosis. I was diagnosed with acute myeloid leukemia, better known as AML, last year in April. It was rough. There were some weird symptoms that took place, a lot of going back and forth to the doctor, trying to figure out what was wrong with myself. And one day in the emergency room, upon a, blood test, we discovered that I had what they call blast cells, and a lot of them in my blood. So with that, I was immediately rushed to the local cancer center and started a very, very intense, grueling chemotherapy regimen. I went into remission for about a year maybe, and unfortunately, the leukemia strikes back. And so here we are. I am preparing for a stem cell transplant within the next week or so. And yes, after so much chemotherapy, I believe I could probably glow in the dark at this point. I've had so much chemotherapy, but I'm preparing for the stem cell transplant. And it will potentially provide a cure for the type of leukemia that I have. So what I have is acute myeloid leukemia, better known as AML. AML is a pretty severe form of leukemia. It's very rare, but it is the most common type of leukemia. So amongst leukemias, it's common in adults. And it's rare, especially in Black and brown people. It's a disease that primarily strikes older white men. So to my surprise, I'm like, where did this come from? Because I'm not an older white man. And it also strikes kids, babies, but it's, kind of rare for a middle-aged Black woman to have AML. It strikes about 20,000 people in the United States per year. And I'm so special that I'm like that 1 in 20,000, kind of sucks, but so yeah, I'm about to have a stem cell transplant, and there are many people out there that are in need. There's so many people, Black and brown people, that are in need of stem cell transplants, white people as well, but there are plenty of Caucasian donors in the system. Unfortunately, there aren't enough Black and brown. So what I would like for you all to do is to go to bethematch.org. Again, that's bethematch.org. Sign up, be a part of the registry so that you can potentially save a life and help somebody get cured of this terrible disease. At the very least, I would like for you all to give blood. Any cancer survivor or anybody with a blood disorder that, at some point has a compromised immune system, especially due to the intense chemotherapy regimens that we go through. At some point, we'll need a blood transfusion or blood platelets. And so you could help somebody simply by donating blood at the Shepherd Blood Community Center or the Red Cross, or I think the other place is the Blood Connection. And there's a couple of places in the area or just throughout the United States that you could give blood at. And that will definitely help somebody, going through chemo, because chemo is no joke. And I've had tons of it at this point. So that's, just a little information on acute myeloid leukemia, which is a form of blood cancer. And it's, it's a day in the life for me. It's not getting the best of me. I'm still doing great. I intend to fully beat this thing and to be cured. I just ask that you all, pray some good, honest prayers for me. I know it's already done because God is just that good to me. So this is just another stumbling block, something that I just have to go through and get over. Life has thrown me lemons and I'm going to make limoncello. So I just want to talk to you guys for a minute. Thank you for watching and listening, and do your part, please, to help somebody else. It would mean a lot to me and to the person that you're going to save. Thank you.